There is a gap between each handoff in care transitions, and it's something that has to be managed. And in order to manage it, you have to know what you're dealing with. You have to know where the barriers are and where our opportunities to change. Our mission and our purpose is to provide great care for our community and help everyone in the Lansing area get what they need and for them to have great health.
Readmission rates are pretty high, but we're doing a great job in our area. And we're trying to find better ways to reduce these readmission rates.
We have focus areas. We have 4 focus areas. We're working with one of them. The original was medication management, and we had community-based care transitions. We had palliative care and advanced care planning, and then the last one was patient engagement. I think really transitions and trying to ease the transitions for the individual and trying to improve their health care and get them more involved in it is really what we focus on. And to do that, you have to focus on community involvement. That you have to get people together. You have to get people to talk to one another.
First and foremost, break down the barriers. On our board alone, we have members and representation from the key hospitals in town, both of them. We have members from all different agencies, whether it is the nursing home, assisted living, we have technology, infrastructure, and everything in between. So really breaking down those barriers, because the first thing you have to do is realize you're all on one team. You're not working against each other, you're working together.
We really just don't have a blame culture. We're not blaming each other. We're realizing that it's systems that are not working, and we're willing to share the information back and forth and talk about, what's not working so that we can fix it. One of the big examples is from the hospital to skilled nursing. We have access now to the electronic medical records, so when we get a patient from the hospital, we can see their medication list, we can see labs. So, before, when a person might have come to a skilled nursing, they might have had a lab test done the day before they came, and of course the results weren't in, and we might not even know that had occurred, and then they have some type of a medical crisis in 2 days, and we're sending them back to the emergency room. Now we know those labs have been done. We can see the lab, and we can adjust, adjust medications or do whatever we need to do in our environment.
When I sit at our board meetings every month and look around the table, it's a table of passionate people for our community patients, and we all have mutual patients in some way or another. There's services all across the community. There's different patient choice on where they want to go and what they want to use. That might not always be one system versus the next. I think that the biggest challenge in healthcare is looking past those barriers and looking at what's continuity of care for that patient.